Hello, I'm Hemant and I'm here to explain about Ebola. Ebola is declared as an international emergency. The rising Ebola death toll in West Africa spread the fear throughout the world. Panicking will not help. Instead, educate yourself about the diseases as much as you can. Creating awareness about the disease is the first step towards preventing it. Here's the detailed account on Ebola. What is Ebola? Ebola is a deadly virus disease and it is contagious. On an average, 80% of the people infected with this virus do die. It is formally known as Ebola hemorrhagic fever, as the victims of Ebola suffer from fever, muscle weakness, and other symptoms which finally lead the patient to bleed to death. Ebola first appeared in 1976 in Africa. Two outbreaks simultaneously occurred in Africa, one in a village near the Ebola River in the Democratic Republic of Congo and other in a remote area of Sudan. The origin of the virus is unknown, but based on available evidence, fruit bats are considered the likely host of the Ebola virus. Now let's see the transmission of Ebola virus. Generally, a person must come into contact with an animal which is a host of Ebola, and it can then spread within the community from human to human. In the current outbreak in West Africa, the majority of cases in humans have occurred as a result of human to human transmission. When it comes to spreading the disease, the virus is contagious and the migratory populations are the most likely transmitters of the virus. Infection occurs from the direct contact through the broken skin or mucous membranes with the blood or other bodily fluids or secretions of infected people. Infection can also occur if broken skin or mucous membranes of a healthy person come into contact with the environments that have become contaminated with an Ebola patient's infectious fluids such as soiled clothing, bed linen, or used needles. The virus multiplies rapidly inside the body and if not taken care of may lead to death. Who is most at risk? Health workers, family members or others in close contact with infected people. Mourners who have direct contact with the bodies of these deceased as part of burial ceremonies. What are the symptoms? The incubation period or the time interval from the infected to onset of symptoms is from 2 to 21 days. The patients become contagious once they begin to show symptoms. They are not contagious during the incubation period. After the period of incubation, a person will commonly see the signs that are considered as early symptoms. The early symptoms include fever, headache, stomach pain, rashes, nausea, vomiting, drop in blood pressure. Once the condition has progressed, a person may notice symptoms like sore throat, jaundice, loss of appetite, skin rashes, bleeding. Severe damage to blood vessels can cause internal bleeding. The viral load may increase to an extent that the person may start bleeding from all openings, including pores of the skin. Ultimately, due to the clotting and bleeding, when the blood fails to reach different parts of the body, multiple organ failure may occur, resulting in death. How it is diagnosed? Ebola virus disease infections can only be confirmed through laboratory testing. 1. CBC, complete blood count. 2. Coagulation studies. 3. Viral antigen testing and liver function test. Once diagnosed, what kind of treatment does the disease have? There is no definitive treatment, and common antivirus therapies do not work on Ebola virus. Therefore, the goal of the treatment is to treat the symptoms and prevent the secondary infections or complications. How can it be prevented? There aren't any vaccinations available as of now, so basic hygiene of importance and must to prevent the onset of the condition. Simple activities like washing your hands well, drinking water from a clean source, maintaining general hygiene and cooking yourself your meat well can all serve as a precautionary measures. Should people in India worry? It's not prevalent in India, but people living in remote areas where living conditions are poor and always at risk of getting infected, but largely there is no need to worry as such. There is no cure for Ebola. But local studies by Nigerian scientists and several foreign researchers indicate that the plants, or rather herbal medicine, hold the hope for globally accepted cure for AVB. As of now, you don't have any threat from Ebola, so you better maintain some hygiene and be positive. Bye. This is Hemant. Take care.